Hello, I'm Dr Marcus Hughes. I'm a consultant in Liaison Psychiatry and I'm going to be giving the talk on Liaison Psychiatry. Liaison Psychiatry is a subspecialty of general adult psychiatry, and we see and treat and assess patients who may be suffering from mental health problems, most often in general hospitals, although liaison psychiatrists do work in other settings, sometimes in the community and sometimes in specialist hospitals. The areas that I'm going to cover in my lecture are broadly in keeping with the different areas of the hospital where we work. So I'm going to talk a little bit about our work in the accident and emergency department, where we tend to see psychiatric emergencies, including deliberate self-harm. And I'll give an example of a patient presenting with deliberate self-harm and the kind of considerations that we need to think about when we're seeing and assessing a patient with deliberate self-harm. I'll then move on to talk about a different group of patients, and those are the patients who are admitted to medical wards, who tend to be older and are more likely to suffer from the mental health problems that affect older people, sometimes known as the 3Ds, delirium, dementia and depression. And so I'll give another case example of a patient presenting with some of those problems and talk through how we approach patients on the wards. The third area of my talk is about chronic pain, and we've included chronic pain as an example of a long-term condition. We might see patients with chronic pain in our outpatient department in the liaison psychiatry team, and of course we'll also see patients with chronic pain on the wards. But it's important for all of us as doctors to know how to treat patients with long-term conditions, because as people are living older, there'll be more and more people who are living with long-term conditions, and this will become a feature of all of our work as doctors. Finally, we'll finish with an OSCE station where we'll look at mental capacity, because as liaison psychiatrists, we're often called up to see patients on the ward where there are specialist questions about their capacity or some uncertainty about their ability to make decisions about their medical or surgical management. And so we'll go through an OSCE station at the end of the presentation. Thank you.